Hi, I'm Joy. I'm going to be giving a tour of our family maternity unit so that women who are coming to us in labor can know what to expect and kind of get a sense of where they're going, and also talk about the process of when you come in when you're in labor. So this is a locked unit. When you enter the unit, you would come in through the emergency room. They would direct you to the proper floor, and then you would ring the doorbell and they would let you in. Directly off of that is the waiting area and the coffee and snack area for visitors, significant others. You would come in here. Right in front of you is the NICU door. It's also locked. Here you would just register. So you would say, hi, who you are, what's going on, and they would register you so that then we could get you to the proper location. Over this direction is, so you would follow this desk around. This is the postpartum area, actually. So after you have a baby, after 2 hours of recovery time, you're then brought to these areas. And these rooms, unfortunately tonight, they are not available for a tour, so to speak. I have one room I am going to take you in and kind of just angle up because it isn't cleaned, but there's no one in it. Just to kind of give you a sense, there's a television, an easy chair, the bed, another easy chair that pulls out so you can sleep. We have cots and things as well, a sink, a shower, sink, and toilet in a very tiny area. So that is that. So yes, 8 postpartum rooms. This would have been the old nursery. No babies are kept in the nursery anymore. It is used for things like circumcisions and like hearing screening, newborn screenings that need to be done before discharge. And so there are no babies in the nursery area. If you come down this hallway, this is the labor and delivery unit, and we have rooms A through F. This is one of the rooms. It's a rather large room. And it has the standard everything in it. I will show a more normal sized room in just a second. When you come down here, you're going to get yourself weighed so that we have a starting weight for you when you arrive. This is the monitor for any babies' tracings that we need to be monitoring. The nurse's desk is over here, and then in this area on this side is the whirlpool. We do have people who use a whirlpool. It wouldn't be the first thing you would come to. We would start with monitoring a little bit, make sure everything's going well. But this is a great way to manage labor pain. And so it's a small room, just very straightforward. The whirlpool is short and low. You can kind of sit on the edge and then swing your feet in. And it's a pretty decently sized tub, has a jacuzzi jets. And we can monitor the baby with the Doppler in this while you're laboring some. We cannot birth in this room because there is nowhere to do any rescue maneuvers if there were to be an emergency. So after we take your weight, we would then bring you into one of the labor rooms. And so they all go by A, B, C, D, and they have the B by the door and a B on the door. So this is the labor room that you would come in, and initially they would have you come in, use the restroom, put on your gown if you're wearing your gown, and so this is the restroom. And the toilet, again, very tiny, and a very tiny shower, but it's there. And also people have used the showers for comfort in labor. So you come come in, use the bathroom, maybe put your gown on, and then we would, usually we want to monitor what's going on. So the bed is just a bed. It is a prop to be used in the process of labor. But initially we do have you get in the bed, sit on the bed at least, or maybe stand next to it, and we would hook you up so that we can see what the baby's response to your labor is and your own contraction pattern. So to do that, usually we use the wire monitor for that initial 20 minutes or so, whatever is needed. This is the baby's heartbeat monitor, and so that goes on your belly and it's kind of strapped on with a stretchy pink or blue belt, and it listens to the baby's heartbeat, and then that transfers an image up here showing us, the heartbeat, if there's any accels, if there's any decels, what's happening with the baby. And then there's a monitor for the mom. This one is a monitor for the mom, and this is just a push button for if she's having contractions, and this gets strapped onto the belly as well. It does not tell us the strength of the contractions, it just tells us when and how long they're lasting. Skinny ladies, there's not much cushion between the button, and so your contractions might show up very big, but you might not be feeling them at all or much at all. And so or someone who might have a little extra around their middle section might have a lot more cushion between the button and the uterus, and so when the uterus contracts we might not be picking up much at all, and yet they're still having very strong and painful contractions. So it's just an external monitor, but then that's going to transmit up here as well, and we're going to see contractions happening and how often are they happening, are they strong, are they painful. That's all part of the process. We also would take blood pressure and monitor. There's a finger thing here for checking your heart rate and your oxygenation status and things. And so once we get that initial assessment in, we can determine, is everything normal? Is everything going well with you and the baby? From there, we can decide, do we need to keep you on a monitor continuously, or can you do intermittent monitoring? And there are some electronic monitors that are wireless that we can use. Sometimes it's not appropriate for them to be used, and sometimes it is. So, and that could be a discussion as well. But wireless monitors can give you more freedom to move about if laboring upright and moving is what you want to do. So we get the monitoring going, and then another thing that we would like to do early on if you are in labor, once it's determined that you are in labor and that you're staying, is to start an IV site. So, and again, having you in a bed is handy. Hold on a second. So having you in a bed is handy because, again, during that time we can get this going. An IV site would be useful to give you medicine in the case of an emergency. If we don't need it for medicine or fluids or anything, we don't use it, but it's just there in case of an emergency. It's very hard to get an IV site to give you medicines while an emergency is happening, and so we try to place it somewhere where it's not, you're not bending it. If it's in your elbow, every time you bend your arm, which will be often in labor, you are not going to be happy with all of us running in every time the pump beeps and things like that. So yeah, just an IV site. When we do that, we draw basic labs, so your blood count, RPR, hepatitis B, type and screen. Those are the usual ones. Those are the usual ones, unless there's some other things going on. And again, we would tell you what we wanted to do and why. So yeah, so monitoring, we get an IV site in, and then from there, plan on how your labor is going to go. I want to emphasize the bed again is just a prop, and so we can move it in multiple positions. We can use a birthing ball. We have balls to sit on, a little stand to prevent it. We have a lot of equipment, pillows to be able to use on the bed, and I have some videos demonstrating use of those. Here for the dads or for the partners, we have chairs that can fold out into beds. We will often have an easy chair with a leg lift as well. So not big rooms, but useful. This, I would like to mention the baby bassinet. I mentioned in one of the other videos, when the baby's born, while it's in the hospital, if it's leaving the room, and it will be used, it would be placed in a bassinet. Even if you're taking it out of the room and just carrying it around, if you need to take a walk, the baby needs to be in a bassinet to prevent any dropping, injuries, those kinds of things. And so this is the baby bassinet, and in it would be diapers and wipes and baby shirts, things like that, baby care items. On the note, also, as far as like coming in, what to bring, we have pillows, clearly we have blankets, we have pads and underwear, but I would encourage you to bring shampoo, toothpaste, a bathrobe, slippers. If you have any like laboring support measures like a tennis ball to maybe rub on your back. If you want, a humidifier. I've had people bring in their gaming system and do some gaming while they're here. Bring things to read, your computers, your charging phone cords, those kinds of things. These areas up here are just housing, again, the emergency call bell, and then over there is some like oxygen and other emergency items. The warmer, I didn't mention the warmer. So when babies are born, usually we just put them right up onto mommy's belly, dry them off, let the cord pulse, make sure everything's going well. So are they crying? Are they breathing? Is there good tone and color? If everything's fine, we let the cord pulse. A lot of people ask me, can we delay cord clamping? Yes, we do that, and we do that on a regular basis. If mom's bleeding, if baby's not breathing, that's a different story, and we need to move more quickly. But generally, babies go right up onto mom's belly. Once the cord has stopped pulsing, or the placenta starts to release, we would then clamp the cord. The significant other can cut the cord, and then we need to get the placenta out. I would also disclose that standard of care across the world is to use Pitocin as a form of getting that placenta to release more quickly, to decrease maternal bleeding. Waiting for the normal processes, women bleed much, much more, and you can decrease her blood loss by half if you use Pitocin. And so we use it. We would tell you we're going to use Pitocin for the postpartum delivery of the placenta. If you don't want that, you can decline it, but we would then watch closely to make sure you're not bleeding heavily. So anyway, Pitocin, placenta comes out, then we clean everything up, make sure everything's right. If there's a tear, we repair the tear. During that time, if everything's good, the baby stays with mom on her belly, just there. We can assess the baby there, listen to a heartbeat, all those things. For 2 hours, we try to keep the baby with mom. We encourage breastfeeding during that time, skin to skin time. It all happens there. If the baby isn't breathing or there's some emergency, the baby can be moved to the warmer. This is where we can weigh the baby. We can do If at the end of the 2-hour period, if this is what parents are wanting, we will do the vitamin K shot and the erythromycin eye ointment here. So all of it's happening in the room with the parents. Trying to think if there's much else to say. Birth process. Yeah, that's about it. And then 2 hours of recovery. And then we move out to the postpartum floor. Thank you. This was really fun. I hope that was a good tour, and hopefully it answered many questions for you. Thank you so much.
Yes.